Hi everyone, myself Saranya, Assistant Professor, SNS College of Allied Health Science, Coimbatore. Today we are going to discuss a topic on hemodilution. Hemodilution is a major aspect of cardiopulmonary bypass. As we are doing a cardiac surgery, there is a high loss of blood for the patient. To compensate that, we are using a solution to dilute the blood which is called as hemodilution. The CPB circuit is primed with a crystalloid or a colloid solution. This results in hemodilution of the patient. The degree of hemodilution caused by the CPB can be calculated before initiating the bypass so that the priming solution can be adjusted to incorporate the red blood cells needed to the patient. So you want to know the HB level of the patient before going on bypass. So according to the HB level, you can calculate the HCT, which is called as hematocrit, and with the help of hematocrit we can do the calculation. Benefits of doing this hemodilution. So reduces the severe strain in hospital blood bank by use of the whole blood for the priming circuit. Clinical benefit of the crystalloid prime was improved oxygen during bypass, reduced blood viscosity, increase in microvascular blood flow. Hemodilution, especially in patients with polycythemia, produce an absolute reduction in number of RBC cells and increase the likelihood of exposure to oxygen. So, to reduce the blood strains of the hospital blood bank and also to the proper oxygenation therapy, and for the patients with polycythemia, it is better to go with a hemodilution technique. Physiological consequences of hemodilution. How this hemodilution is effectively working out. So, the force applied to an area of a liquid confined between the two plates, the sufficient to set the liquid in motion is called shear stress. So based on the shear stress and the shear force, this hemodilution will be activated. The velocity at which the liquid moves in a proportion to the separation of the plates is called a shear rate. Hypotension resulting from hemodilution on bypass. Why? Because the blood have a protein which helps in the presentation of the blood pressure. While we are decreasing the protein level because of hemodilution, that can lead to hypotension. Perfusion pressure falls in direct proportion to the change in velocity. Hematocrit is a major determinant of oxygen carrying capacity of the blood. HCT should be less than 30% during bypass. Normally it should be near to 60%. The minimum acceptable HCT should meet the oxygen delivery requirement to match the systemic oxygen consumption. As during cardiac surgery, we are decreasing the patient body temperature, we are making them as an hypothermic so that it is easy for us to reduce the oxygen needed also. A normal hematocrit level will be meeting 36 to 48% accordingly. The O2 content and delivery. So how to maintain the O2 content and delivery in the cardiac surgery patients? Oxygen content is the main amount, amount of oxygen in certain volume of blood. So oxygen binding capacity is a maximum amount of oxygen that can bound to the hemoglobin. O2 content depends on the hematocrit level. So maintain a proper hematocrit level or a hemodilution rate to carry the oxygen to the tissues. Factors to focus while reducing the HCT. So oxygen delivery is influenced by the pump flow rate and systemic temperature. So to maintain a proper pump flow rate is very much needed. And oxygen consumption is also alters appropriately proportionally with the temperature. So once the temperature has been reduced, the oxygen consumption rate can also be reduced. Jehovah's Witness patients who refuse a blood transfusion should show the cardiac surgery, and the CPB with low HCT is not only possible but it can be relatively safe for the Jehovah's Witness patients. Their community will refuse the blood transfusion. The factors which affecting the HCT during CPB are patient size, preoperative hemoglobin concentration, pre-CPB blood loss, pre-CPB fluid administration, CPB priming volume and the urine output. Method of reducing an hemodilution is an important factor. Use an autologous blood, that is a patient's own blood, to partially prime the CPB circuit. So the process of you can take the mediastinal shed blood or a residual pump volume so that you can see the decrease in the allogenic blood transfusion and reduced risk of blood transfusion is a major factor. How to reduce the factors is because ensure the hemodynamic stability of the patients and do a safe autologous priming technique. How to do this autologous priming technique? There are two techniques. You can go with an antegrade autologous priming technique or you can go with a retrograde autologous priming technique. So antegrade autologous priming technique utilizes the partial filling of the venous reservoir with the patient's own blood from the venous limb of the circuit before initiating the bypass. Whereas the retrograde autologous priming technique utilizes retrograde filling of a venous reservoir via arterial limb of the CPB circuit just from the aorta before initiating a bypass. So what is hematocrit? Is hematocrit during bypass, it should be at 30%, 30 to 40% can be acceptable. Advantage of hemodilution, you can reduce the blood viscosity and increase the microvascular circulation. Autologous priming means using a patient's own blood. Factors which affect the hemodilution is the blood flow, temperature, you can maintain it in a proper way to do a proper hemodilution technique. Thank you for listening.